Good morning. Thanks so much for giving me the opportunity to speak this morning about this really important topic. In our time together this morning, I'd like to cover just a few high-level points. So the first is to discuss recent trends in healthcare, and as we've talked about over the last day or day and a half, they're generally not very reassuring. The second is to highlight areas in healthcare that I think that trust is particularly important. And there's probably any number of areas that we could choose to focus on, but I'll highlight just three of them. And the third is to suggest some ways that we might think about starting to maintain or to rebuild trust. But first, I think it's important to recognize just how pervasive trust is in our everyday lives. So trust in one another and in our institutions is critical for our social and economic well-being. So I think it's important to recognize that trust helps us forge bonds between people and organizations. It allows us to work and to buy and to sell and to vote with some reasonable expectation that that behavior will be met with fairness and goodwill. It's also important to define trust and distinguish it from other related social constructs. So trust necessarily contains within it elements of risk and elements of vulnerability. It's necessary when we're unsure about the motives of another, but we have to have faith that they're going to act in our best interest. Trust is also voluntary and it's prospective, which distinguishes it from dependency, which is largely involuntary, and from satisfaction or from discontent, which are both appraisals of how things went in the past as opposed to appraisals of how things might go going forward. And finally, trust is malleable, and anyone who's had their trust broken knows that. But I think that also means that there's an opportunity to use strategies to try to rebuild trust. So the Nobel Prize winning economist Kenneth Arrow, he once wrote that virtually every commercial transaction has within it an element of trust. And much of the economic backwardness in the world can be explained by the lack of mutual confidence. So consider the trust that's embedded in something as simple as going to get a haircut. So I recently got a haircut, a rather poor haircut, but I enter my credit card information online to order an Uber. I trust that it's going to be kept secure and private. I walk across a busy intersection when street lights tell me to do so, trusting that other street lights will instruct the oncoming traffic to stop. I get into a complete stranger's car, and I trust that he's not going to kidnap me, and he's not going to drive so recklessly that we'll get into an accident. I then get in front of a barber, someone who I've never met, and I trust him to wield scissors within millimeters of my head, and trust that he's not going to poke my eye out or cut my ear off. And then he takes the cash that's in my pocket, and he trusts that the cotton and the linen that constitute the US dollar, that they mean something, that someone will accept that for food and for diapers and for an apartment. And so trust really does pervade every part of our daily lives. And so I think it's all the more important that we examine why trust is declining and what, if anything, that we can do to reverse that. So as we talk about trust today, I also want us all to reflect on our roles both within healthcare and outside of healthcare. So many of us have, of course, worked as clinicians through our career or other forms of healthcare professionals, but we've also held other roles in other institutions that operate on trust. So many of us have, for instance, written for or worked in the media, and as we heard yesterday, trust in the media is at historic lows. So less than 1/3 of Americans have even a fair amount of trust in the media. And that's down from nearly 3/4 who said they did in the 1970s. A lot of us have worked in the government at some point, and recent surveys suggest that only 15% of Americans trust the federal government to do what's right even most of the time. Again, that's down from about 75% in the 1960s. Almost all of us have been part of institutions of higher learning during our careers, and even here, distrust is on the rise. So certain social and political groups now view colleges as having an overall negative impact on the country. And despite increasing education levels, the public's trust in the scientific community has been declining. That's especially true among conservatives. So conservatives in 1974 who had a college degree had among the highest levels of trust in the scientific community, and today they have among the lowest levels. So trust has been declining for decades, and it's currently taking an additional beating among anti-elite sentiment and rhetoric, and many of our leaders seem more concerned with nurturing public suspicion than they do with nurturing public trust. And you might hope or think that medicine and healthcare have been spared, but they haven't. So in the 1960s, more than 3/4 of Americans had great confidence in their medical leaders, and today only about 1/3 do. Compared to people in other developed countries, Americans are considerably less likely to trust doctors as a profession, and only 1/4 say that they have confidence in the medical system overall. And during some recent disease outbreaks, only 1/3 of Americans say that they trust public health officials to share complete and accurate information. And I do want to highlight an apparent paradox here, which we can return to at the end. It's that while Americans are generally more distrustful of the medical profession and of the health system overall, they're generally more satisfied with their own care, the care that they receive from their own physicians and nurses, than people are in other countries. So this was a survey, I think, of about 35 similar countries, and we ranked 3rd on that metric, but 24th in overall trust in the health system. So in some ways, it's similar to what we see in Congress, where people tend to like their own elected representative, but they're generally distrustful or they dislike Congress as a whole. So why does this matter? Well, medicine is a uniquely human and personal field, and there are probably many reasons that trust is critical for the delivery of good medical care and the preservation and the promotion of good public health. I'll try to highlight just 3 main areas. So the first is that trust makes people more likely to engage in healthful behaviors, at least trying to abstain from smoking or trying to change their behavior in a positive way. The second is that trust can allow innovation to flourish, and lack of trust can sometimes stifle innovation. And the third is that trust can help us better respond to public health crises and other epidemics. So trust is, of course, the cornerstone of the doctor-patient relationship. Patients who trust their doctors are more likely to follow through on treatment plans. So trust is strongly correlated with adherence. So nearly 2/3 of patients with high levels of trust in their doctors say that they always take their medications as prescribed, and that's compared to only 14% of patients with low levels of trust. Trust is also one of the best predictors of whether patients will try to engage in other health behaviors that their doctors recommend. So things like exercise, smoking cessation, eating a healthier diet, using condoms, all these things are correlated with patients, the degree to which patients trust their doctors. And trust is critical for patient satisfaction. It makes it more likely that patients will continue to see the same provider over time, which, as we know, can have all sorts of other positive effects. There's also large disparities in trust along racial and socioeconomic lines, which I won't get into, but suffice it to say that building trust among vulnerable and marginalized populations might be particularly important. So for patients with HIV, for example, trust in their medical providers is associated with a higher likelihood that they will take antiretroviral drugs, better self-reported mental health, better self-reported physical health, higher likelihood of keeping their clinic appointments, and a lower likelihood of unexpected emergency department visits. Uh, States with a higher level of overall social trust also seem to have lower levels of late HIV diagnoses, so after the disease has progressed. And there's a thought that that's because people feel more comfortable coming forward, getting tested, and seeking care. So evidence suggests that trust is correlated with things like adherence, things like screening, and continuity of care. So low levels of trust can also potentially hurt innovation. I think we tend to think of innovation as being driven by doctors and scientists and entrepreneurs, but patients play an important role too. So they have to be willing to try to engage with new technologies, new treatments in order for them to spread, but they're unlikely to do that if they don't trust in either the motives of the prescriber or the efficacy of the treatment. One study found that for cancer patients who are contemplating enrolling in an experimental trial, trust was among the best predictors of whether patients would ultimately enroll in that trial. And it was actually on par with the belief that the trial would actually help them and put them in remission. So it can be a very powerful force for people trying new and unexpected things. Today, I think in an era of wearable devices and electronic health records, trust that one's personal data will be kept secure and private is a really important part of helping those technologies spread. And despite millions of dollars being poured into telemedicine, Americans are still much less likely to trust a diagnosis that's arrived at remotely than they are arrived at in person. And finally, perhaps most concerning is evidence that low levels of trust can weaken our ability to respond to public health crises and epidemics. And so a recent study found that, or suggests that Ebola spread more widely and spread longer than it otherwise would have if there were higher levels of institutional trust. So researchers, they surveyed people in Liberia about things like their knowledge of Ebola, how much they trusted the government, how willing or how likely they were to engage in certain precautionary measures. And these measures were things like abiding by curfews, keeping chlorinated water at home, avoiding contact with people who were displaying symptoms, adopting safe burial practices. And what they found was people who didn't trust the government were much less likely to engage in any of these precautionary measures. And what was interesting is that they weren't less well informed. So they didn't know less about Ebola. They didn't have more erroneous beliefs about Ebola. They just trusted the government less. So in the US, obviously, mistrust of science and medicine can lead to people skipping the flu shot, foregoing the measles vaccine for their children. That obviously has all sorts of negative consequences, both for the individual but also for the broader population. So given all that, can trust be rebuilt? And what can we do to do that? And that is what this whole forum is about, so I won't pretend to have any quick fixes, but I'd like to offer a few things for discussion. So I think trust depends fundamentally on answering these three questions. So do you know what you're doing? And that is a question of competence. The second is, will you tell me what you're doing? That is a question of transparency. And the third is, are you doing it to help me, or are you doing it to help yourself? And that final one is a question of motive. So I think we can start to rebuild trust by using strategies that try to answer these three questions for patients. So the first part of this, I think, is using clear and transparent communication, so taking the extra time to make sure that patients know what is happening, what they can expect going forward, explaining the intricacies of treatments, having a sense that you're coming to that decision together. The second point might sound obvious, but I do think that a history of fulfilled trust is probably the best predictor in people's mind about whether their trust can be expected to be fulfilled in the future. So if you say that you're going to call a patient at a certain time, making sure that you call them. If you say on morning rounds, you'll swing back around in the afternoon to continue your conversation. Doing those types of small things can, I think, at least get us on the path to creating trust. The third point is, as with any relationship, creating the expectation for a long-term relationship through repeated interactions can help build trust. And I think this part can help us capitalize on that paradox of trust, where people do trust and they are satisfied with the care that they receive. So the more that we can have individual patients interacting, I think, with the same doctor, the same nurse, the same care manager, that can potentially be effective. The fourth issue here is around promoting shared interests and minimizing power differences. So there's obviously inherently a large information asymmetry and knowledge asymmetry between patients and doctors. And when that grows too large, it becomes a relationship of dependency as opposed to a relationship that's built on trust. And so trying to minimize those power differences, I think, is another useful thing to think about. Fifth is disclosing conflicts of interest that gets at questions of transparency and of motive. Sixth is this idea of community-based participatory research. And the idea is that many patients have traditionally been wary of both the methods and the motives of clinical research, and giving patients greater say, going to communities, going to patients, giving them greater say in the design, in the goals, and the dissemination of research. It can help ease the sense that research is being conducted on them as opposed to with them. So CBPR has been proposed as another strategy. And finally, governments and institutions should consider identifying and using trusted spokespeople in moments of crisis. So as we've heard before, the messenger often does actually matter. In disease outbreaks that are caused by bioterrorism, Americans are much more likely to trust information that's coming from the CDC as compared to the FBI or the Department of Health and Human Services. So the more that we can identify those trusted spokespeople and use them, that's another way we can be effective. And I'll conclude by saying that all institutions and all providers are, of course, imperfect, and a degree of skepticism is healthy, a degree of skepticism is important. America was in some ways founded on skepticism of power and authority. We have separation of powers and checks and balances and relatively limited government. But in recent years, the pendulum might have swung too far. And when distrust becomes pervasive, it can erode the glue that holds us together and can inhibit our ability to keep people healthy. So I'll pause there. Thank you so much for your time and attention, and I'll turn it over to Dr. Cooper.